Hey, Alpha Nurses, I'm Licensure from AlphaNursGuide.com. This is 15 practice NCLEX questions. Without delay, let's get started.
A multigravida client is admitted at 16 weeks gestation with a diagnosis of hyperemesis gravidarum. The nurse should explain to the client that hyperemesis gravidarum is thought to be related to high levels of which of the following hormones? 1. Progesterone. 2. Estrogen. 3. Somatotropin. 4. Aldosterone. The correct answer is 2. Although the cause of hyperemesis is still unclear, it is thought to be related to high estrogen and human chorionic gonadotropin levels or to trophoblastic activity or gonadotropin production. Hyperemesis is also associated with infectious conditions such as hepatitis or encephalitis, intestinal obstruction, peptic ulcer, and hydatidiform mole. Progesterone is a relaxant used during pregnancy and would not stimulate vomiting. Somatotropin is a growth hormone used in children. Aldosterone is a male hormone. Assessment of a prima gravida client in active labor who has had no analgesia or anesthesia reveals complete cervical effacement, dilation of 8 centimeters, and the fetus at 0 station. The nurse should expect the client to exhibit which of the following behaviors during this phase of labor? 1. Excitement. 2. Loss of control. 3. Numbness of the legs. 4. Feelings of relief. The correct answer is 2. Assessment findings indicate that the client is in the transition phase of labor. During this phase, it is not unusual for clients to exhibit a loss of control or irritability. Leg tremors, nausea, vomiting, and urge to bear down also are common. Excitement is associated with the latent phase of labor. Numbness of the legs may occur when epidural anesthesia has been given. However, it is rare when no anesthesia is given. Feelings of relief generally occur during the second stage, when the client begins bearing down efforts. A mother asks the nurse if her child's iron deficiency anemia is related to the child's frequent infections. The nurse responds based on the understanding of which of the following? 1. Little is known about iron deficiency anemia and its relationship to infection in children. 2. Children with iron deficiency anemia are more susceptible to infection than are other children. 3. Children with iron deficiency anemia are less susceptible to infection than are other children. 4. Children with iron deficiency anemia are equally as susceptible to infection as are other children. The correct answer is 2. Children with iron deficiency anemia are more susceptible to infection because of marked decreases in bone marrow functioning with microcytosis. A laboring client at -2 station has a spontaneous rupture of the membranes, and a cord immediately protrudes from the vagina. The nurse should first: 1. Place gentle pressure upward on the fetal head. 2. Place the cord back into the vagina to keep it moist. 3. Begin oxygen by face mask at 8 to 10 liters per minute. 4. Turn the client on her left side. The correct answer is 1. The nurse should place a hand on the fetal head and provide gentle upward pressure to relieve compression on the cord. Doing so allows oxygen to continue flowing to the fetus. The cord should never be placed back into the vagina because doing so may further compress it. Administering oxygen is an appropriate measure but will not serve a useful purpose until the pressure is relieved on the cord, enabling perfusion to the infant. Turning the client to her left side facilitates better perfusion to the mother, but until the compression on the cord is relieved, the increased oxygen will not serve its purpose. Placing the client in a Trendelenburg or knee chest position would be position changes to increase perfusion to the infant by relieving cord compression. Which of the following would the nurse include in the teaching plan for a 16-year-old prima gravida client in early labor concerning active relaxation techniques to help her cope with pain? 1. Relaxing uninvolved body muscles during uterine contractions. 2. Practicing being in a deep meditative, sleep-like state. 3. Focusing on an object in a room during contractions. 4. Breathing rapidly and deeply between contractions. The correct answer is 1. Childbirth educators use various techniques and methods to prepare parents for labor and birth. Active relaxation involves relaxing uninvolved muscle groups while contracting a specific group and using chest breathing techniques to lift the diaphragm off the contracting uterus. A deep meditative, sleep-like state is a form of passive relaxation. Focusing on an object in the room is part of Lamaze technique for distraction. Breathing rapidly and deeply can lead to hyperventilation and is not recommended. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguy.com. Back to the questions. A multigravida client at 34 weeks gestation is being treated with indomethacin to halt preterm labor. If the client gives birth to a preterm infant, the nurse should notify the nursery personnel about this therapy because of the possibility for which of the following? 1. Pulmonary hypertension. 2. Respiratory distress syndrome. 3. Hyperbilirubinemia. 4. Cardiomyopathy. The correct answer is 1. Indomethacin has been successfully used to halt preterm labor. However, if the client should give birth to a preterm infant, the nurse would notify the nursery personnel about the tocolytic therapy because this drug can lead to premature closure of the fetal ductus arteriosus, resulting in pulmonary hypertension. Prematurity is associated with RDS because of the immaturity of the fetal lungs. RDS is not a result of indomethacin. Hyperbilirubinemia is more common in preterm infants. Use of indomethacin to halt preterm labor is not associated with cardiomyopathy in the infant. A client diagnosed with schizophrenia is brought to the hospital from a group home where he became agitated, threw a chair at another client, and has been refusing medication for 8 weeks. The client exhibits a flat affect, is not caring for his hygiene, and has become increasingly withdrawn and asocial. The primary healthcare provider prescribes treatment with risperidone to improve the client's negative and positive symptoms of schizophrenia. When evaluating the drug's effectiveness on the client's negative symptoms, the nurse should expect improvement in which of the following? 1. Apathy, affect social isolation. 2. Agitation, delusions, hallucinations. 3. Hostility, ideas of reference, tangential speech. 4. Aggression, bizarre behavior, illusions. The correct answer is 1. When determining the effectiveness of risperidone, the nurse would expect improvement in the client's negative symptoms of apathy, flat affect, and social withdrawal. Delusions, hallucinations, illusions, and ideas of reference are positive symptoms of schizophrenia. Agitation, hostility, and aggression are the result of the positive symptoms. A primiparous client has just given birth. The primary healthcare provider has informed the labor nurse that he believes the uterus has inverted. Which of the following would help to confirm this diagnosis? Select all that apply. 1. Hypotension. 2. Gush of blood from the vagina. 3. Intense, severe, tearing type of abdominal pain. 4. Uterus is hard and in a constant state of contraction. 5. Inability to palpate the uterus. 6. Diaphoresis. The correct answers are 1, 2, 5, and 6. Uterine inversion is indicated by a sudden gush of blood from the vagina, leading to decreased blood pressure and an inability to palpate the uterus, since it may be in or protruding from the vagina, and any signs of blood loss, such as diaphoresis, paleness, or dizziness could be observed at this time. Intense pain and a hard contracting uterus are not associated with uterine inversion. A client with gestational diabetes who is entering her 3rd trimester is learning how to monitor her fetus's movements. After teaching the client about the kick count, the nurse should provide further instruction if the client makes which of the following statements? 1. The baby may be more active at different times of the day. 2. How I feel my baby move is different than my friend. 3. The baby should be moving less than 10 times in 2 hours. 4. The baby may not move at times because it is asleep. The correct answer is 3. Feeling 4 kicks in 30 minutes or feeling 10 or more kicks in 2 hours are norms. Fetuses are more active at various times of the day, particularly after mother has eaten when the blood glucose level is high, and in the evening. Each individual perceives their fetus to move differently. Fetuses do sleep several times per day for about 30 minutes each time. An outpatient client who has been receiving haloperidol for 2 days develops muscular rigidity, altered consciousness, a temperature of 103 degrees Fahrenheit, and trouble breathing on day 3. The nurse interprets these findings as indicating which of the following? 1. Neuroleptic malignant syndrome. 2. Tardive dyskinesia. 3. Extrapyramidal adverse effects. 4. Drug-induced Parkinsonism. The correct answer is 1. The client is exhibiting hallmark signs and symptoms of life-threatening neuroleptic malignant syndrome induced by the haloperidol. Tardive dyskinesia usually occurs later in treatment, typically months to years later. Extrapyramidal adverse effects and drug-induced Parkinsonism, although common, are not life-threatening. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The nurse assesses a primiparous client with ruptured membranes in labor for 20 hours. The nurse identifies late decelerations on the monitor and initiates standard procedures for the labor client with this wave pattern. Which intervention should the nurse perform? Select all that apply. 1. Administering oxygen via mask to the client. 2. Questioning the client about the effectiveness of pain relief. 3. Placing the client on her side. 4. Readjusting the monitor to a more comfortable position. 5. Applying an internal fetal monitor. The correct answers are 1, 3, and 5. Decelerations alert the nurse that the fetus is experiencing decreased blood flow from the placenta. Administering oxygen will increase tissue perfusion. Placing the mother on her side will increase placental perfusion and decrease cord compression. Using an internal fetal monitor would help in identifying a possible underlying cause of the decelerations, such as metabolic acidosis. Assessing for pain relief and readjusting the monitor would have no effect on correcting the late decelerations. A prima gravida client with diabetes at 39 weeks gestation is seen in the high-risk clinic. The primary health care provider estimates that the fetus weighs at least 4,500 grams. The client asks, "What causes the baby to be so large?" The nurse's response is based on the understanding that fetal macrosomia is usually related to which of the following? 1. Family history of large infants. 2. Fetal anomalies. 3. Maternal hyperglycemia. 4. Maternal hypertension. The correct answer is 3. Maternal hyperglycemia and poor control of the mother's diabetes mellitus have been implicated in fetal macrosomia. When the mother is hyperglycemic, large amount of amino acids, free fatty acids, and glucose are transferred to the fetus. Although maternal insulin does not cross the placenta, the fetal pancreas responds by hypertrophy of the islet cells of the pancreas. The islet cells produce large amounts of insulin, which acts as a growth hormone. A family history of large infants usually is not the reason for large for gestational age fetuses in diabetic mothers. Maternal hypertension is associated with small for gestational age fetuses because of vasoconstriction of the maternal and placental blood vessels. When working with clients who are experiencing chronic mental illnesses, which of the following should the nurse expect to be generally the least necessary for this client population? 1. Community-based treatment programs. 2. Psychosocial rehabilitation. 3. Employment opportunities. 4. Custodial care in long-term hospitals. The correct answer is 4. During necessary periods of hospitalization, active treatment, rather than custodial care, is needed. Among the more common needs of the chronically mentally ill are community-based treatment programs, psychosocial rehabilitation programs, and employment opportunities. A 69-year-old client is admitted and diagnosed with delirium. Later in the day, he tries to get out of the locked unit. He yells, "Unlock this door. I've got to go see my doctor. I just can't miss my monthly Friday appointment." Which of the following responses by the nurse is most appropriate? 1. Please come away from the door. I'll show you your room. 2. It's Tuesday and you are in the hospital. I'm a nurse. 3. The door is locked to keep you from getting lost. 4. I want you to come eat your lunch before you go to the doctor. The correct answer is 2. Loss of orientation, especially for time and place, is common in delirium. The nurse should orient the client by telling him the time, date, place, and who the client is with. Taking the client to his room and telling him why the door is locked does not address his disorientation. Telling the client to eat before going to the doctor reinforces his disorientation. A multigravida client diagnosed with probable ruptured ectopic pregnancy is scheduled for emergency surgery. In addition to monitoring the client's blood pressure before surgery, which of the following would the nurse assess? 1. Uterine cramping. 2. Abdominal distension. 3. Hemoglobin and hematocrit. 4. Pulse rate. The correct answer is 4. Fallopian tube rupture is an emergency situation because of extensive bleeding into the peritoneal cavity. Shock soon develops if precautionary measures are not taken. The nurse readying a client for surgery should be especially careful to monitor blood pressure and pulse rate for signs of impending shock. The nurse should be prepared to administer fluids, blood, or plasma expanders as necessary through an intravenous line that should already be in place. Because the fertilized ovum has implanted outside the uterus, uterine cramping is unlikely. However, abdominal tenderness or knife-like pain may occur. Abdominal fullness may be present, but abdominal distension is rare unless peritonitis has developed. Although the hemoglobin and hematocrit may be checked routinely before surgery, the laboratory results may not truly reflect the presence or degree of acute hemorrhage. You can get the NCLEX Mastery Bundle now. Link is in the description, or you can get it at alphanurseguy.com.